Hi, I'm Hannah, one of the physical therapists at the Student Health Center at the University of Oregon. We've been doing a series of videos on how to take care of things while you're at home. And if you saw the video already that we did on how to take care of an acute injury, we talked about the principles of Rice. But what we want to do today is show you a couple of exercises that if you have an acutely painful knee, what can you do to start getting a little bit of movement in the knee, start working on your range of motion, and start getting a little bit of movement or ability for the muscles around the knee to contract. So the first is really easy. If you happen to have either a basketball or some sort of a ball, the other thing I like having my patients use if they have one or a roommate or a friend has one is using a skateboard. But what I can do is sitting, if it's my right knee that's sore, if I put my foot onto either a ball and or a skateboard, now what I can do is I can roll the ball or skateboard out, and I can roll the skateboard or the ball in, working through the range of motion that's comfortable on my knee. Again, I'm not looking to create pain. I'm not looking to create significant tension. All I want to do is start getting that ability for the knee to go into flexion and the knee to go into extension. So as soon as we can restore normal active and passive range of motion, the sooner we can start getting the muscles around the knee working more appropriately. Similar to the last one, if I happen not to have a ball and or a skateboard, I can do this lying down. So again, if it's my right knee that's my problematic knee, what I can do is sliding with my heel, I'm going to slide my foot all the way down and slide my foot all the way back up, going through the range again that's comfortable. Sometimes what I'll have people do is make sure you're wearing a sock or maybe put even a folder of some sort underneath the foot so it slides more easily. As you can see, my foot's kind of catching on the rubber floor that we have, and so not ideal because I want to try to do as much as I can where I have as little friction as possible, again, to be able to work on my knee's ability to go into its full range of motion. All right, another exercise I really like for the knee, which starts to work on both range of motion and now starts to work a little bit on strength, is one on my belly. Now I do like putting a pillow underneath the stomach. If you notice, it's underneath my belly but not underneath my thighs. It's kind of stopping right at my hips. My head, I can cross my arms and either rest my head down or I can turn to the side. In interest of the video, I'm going to keep my head up, but no, I would normally have my head down. If I'm looking at my right knee, what I'm going to do is I'm going to turn my toes underneath, kind of curl my toes so that I'm got weight down through them. And then from here, pushing through the toes and reaching my heel long, I'm going to straighten my knee. Again, still engaging through the toes and the ball of the foot. I'm going to hold for 3 to 5 seconds. And then I'm going to bring it back down. Now the benefits to this exercise is I start working on end range extension, which that end of extension tends to be one of the motions we lose when we hurt our knee acutely. And so end range extension is really important for normal movements and especially for gait. Now the other component to this is as I come up into this exercise or position, my glute helps to get me there, but it's my quad and my calf that hold me there. So I'm starting to get a little bit of strengthening with this exercise, and again, still engaging through my toes and then coming back down. So the last exercise I like for acute knees, again, similar to the one that we just showed you on the belly, is going to be in standing. So I can use a ball. I really like balls that have a little bit of softness, so if you have a volleyball or soccer ball that's lost some of the air, or basketball, that'll be perfect. But what I'm going to do with the ball is I'm going to stand near the wall and say it's my left knee I want to actually work. So I'm going to put the ball right behind my knee. And again, having the heel probably 2 to 3 inches away from the wall, what I'm going to do from here is loading through that foot is just push the back of my knee into the wall. I'm going to hold for 3 to 5 seconds and back down. If you notice, I didn't hinge through my hip. My hip is staying, or hips are staying nice and still. As I push that knee back, hold, and then relax. Again, as I push back, I'm getting that mobility for that end range extension, and I'm starting to get a little bit of activation in my quad. And that foot pushing into the ground gets a little bit of activation in the heel. So those are really simple. You know, there's a lot of other things you can do, but those are a couple of nice, quick, easy ways to start getting a little bit of movement, a little bit of strength around the knee with an acute injury. So thanks for watching, and we'll see you next time.